Practice ideas for homework. Try to detect the soft tissue adhesions in each of these areas. You can try for neck pain, rotator cuff or shoulder pain, biceps pain or arm pain, tennis elbow, or golfer's elbow, and carpal tunnel or wrist pain. And remember to work above, below, and through each area. Where and how would you use the strokes of sweeping, fanning, brushing, strumming, framing, and the J stroke? Lower body techniques for homework. Detect soft tissue adhesions in these areas: low back pain, hip, sciatic pain, knee pain, ankle pain. Work above, below, and through using your sweeping, fanning, brushing, strumming, framing, and J stroke.
Here's some various examples of dynamic movements or using an active release type technique with the gua saw or IASTM tools. Here's some sweeping strokes with the adductor as we're moving the leg into external rotation and abduction. Using brushing, strumming strokes, and going on diagonal patterns, making sure we get it in every direction. Lotion has already been applied and the muscles have been warmed up with deep tissue massage and the tools being used with lubricant. You would never want to do this without that. Guess I didn't point out on the last one. This one is showing the gastrocnemius, soleus, and the perineals on the side. The last one I was going to say that we did a little bit of the TFL and working some of the vastus lateralis attachments while I was having the leg rotate in and out in internal external rotation. This one we're doing a little dorsiflexion with the foot. You could have your client do that themselves, you know, actively, or you can do that to them while they passively lay there. You can switch your hands, and now you can see with the plantar flexion and the tibialis anterior. We can work on the heels, work out any areas, be careful of bone spurs, and then we can grab the tissue in the arch and help a little plantar fasciitis. The dynamic movement here could be them wiggling their toes while we're scraping away. We get a little bit of an active release and mobilization of the soft tissue layers. So she's doing her own toes there. That way I can use two hands. I just want to smooth it out and make it nice afterward. Do a little stretching after your IASTM technique. You also want to stretch the muscle. And then we're adding in the hamstring, right? And the motion there, we're making the leg move. Extending at the knee. Do a little brushing, multi-directional. Here we can see working across the glutes. Right. First sweeping for adhesions, then maybe I find one and I start doing some brushing. Right, and strumming, and here we're moving the leg in internal, external rotation while I'm working across the fibers. Just going back and forth between the sweeping, the brushing, the strumming, back to sweeping, and adding in the dynamic motions. That was my buddy Vince walking by. We're on quarantine, so we might hear dogs barking and cats meowing. Okay, here I'm showing the patella, and without a bolster, we can mobilize the patella. And here I am sliding the patella medial and lateral and working underneath the patella. Sometimes we can get on each edge, but we can't really get under. It's kind of the equivalent when we put somebody's arm behind their back to get under their scapula and work on the subscapularis area. Here we're able to assess some attachments underneath the kneecap that we can't do while the client is bolstered underneath their knee and it's bent. So here we straighten it out and we just mobilize the patella and just working all around, little fat pockets on top, the patella tendon down below, and just getting on every angle. Here, I'm just showing through clothing, right? But we could do this with a sport bra or something too. And so before I was working the obliques, or lat attachments, we can do it in multiple positions. I could do it on the table here. I like some of these active motions, but they're hard to achieve while they're on a table during a massage. But here's some active release for the low back. I can do some brushing and sweeping and strumming and all kinds of stuff down the back while I have her do some active dynamic motion. So here she is just bending at the waist and stretching out those tissues. And I'm just showing over the clothes what options you would have. Here she's crawling her hands to the side. So we work on the lat attachments, obliques, quadratus lumborum. Right, it's kind of getting into child's pose and then tilting sideways, and we get some of those rotary attachments. All right, so just visualize doing this on the skin. We don't do it on the clothes. Just wanted to get some examples for you. Here we're just assessing some of the fascia in the cervical region and then coming back around and doing some more detailed work. Right. Getting right up underneath the occipital bone here. Usually from mid-neck, you work up into the hairline and then from mid-neck down toward the upper traps. So we're doing the upper cervicals that direction. I turn around and do the lower ones. And then we can have our client make some motion. So here, she's going to extend at the neck. I engage on the tissues, and then she brings her head down. Not everybody has the strength to do this, but if they're able to, this is one way you can do it on the massage table. Or here, I'm having my client turn her head, right? So I can get in between, working on all the spiral layers. Get into the splenius. What's she doing here? Here's another idea for working on the quadriceps. I can engage the muscle here by having her leg go off the table and bending at the knee, and then I can assist So I'm working with the sweeping. And I could have a bigger tool and have her go ahead. Oh, here I'm doing some J stroke in the IT band, but in a different position. Or I can use the edge of the tool here. The gua saw tool is pretty nice. It's got a little cutout so I can go above and below the IT band all at once. Blending in the TFL. We change the position. There's another thing we can do. As we bring in the TFL IT band, we engage the leg and heel slides. Right, getting the whole kinetic chain. Here we can see working on the tibialis anterior, assessing. And I can turn my tool over and do a little J stroking, digging away the tibialis anterior away from the bone. And the other edge kind of follows along, getting into the perineal muscles on the side. Now, as I'm doing some of these strokes, I can have her move her foot, or I can move her foot. I can work on all the tendinous attachments while I do a little plantar flexion, dorsiflexion. Here I'm showing working on the hip, the gluteus medius and minimus. Can hit some trigger points with smaller tools. I can do some sweeping and some brushing and strumming. I can do some framing from the greater trochanter. And here I'm adding a little of that active release, some dynamic motion. So I can do it away from the greater trochanter up towards the ilium, or I can wait and follow her down. Can come down, work on the vastus lateralis, TFL, can work in the abductors, the piriformis. I like the sideline position. Here I'm having her do the clamshell, and I don't know, maybe I should have shown from the other way, but we kind of both go down at the same time. She's going a little bit fast and we're going over the clothes, but you just do this, right? Skin on skin if you can. Now we're just like doing the heel slide, except in a sideline position. She's extending her heel down towards the window as I am working on all the deep six.
Up into the gastrocnemius. Active releasing here while doing the brushing stroke, having him flex his foot. He's going to flex and then return. Brushing. Has to stretch for him if he doesn't feel like doing audience participation. I can lean in.
Should probably put a towel there. It's my husband.
Above and below. So if I'm working on Achilles tendon, I want to make sure that I treat the whole gastrocnemius and all the fascia that's in the bottom of the foot, everything around in the same fascial chain. So that's it.
Here we're working on the subclavicular area, all along the sternum. We're doing some framing strokes away from the bone and tying in a little bit of brushing and strumming on the upper pecs. So all along the sternum and all along the subclavicular musculature. We can also work on the sternocleidomastoid. Having her turn her head, we can work at different angles. Be careful to stay on the muscle and not on the carotid artery. Knowing the health of your client, their history. If they're older and they have heart issues and they might have some plaque in their carotid artery, I might want to stay off the front of their neck just to be safe. Here you see I'm working on all the attachments around the head of the deltoid there, or head of the humerus, I mean, over there under the deltoid, working on all the rotator cuff attachments. And then I can do some active dynamic movements. Pec Minor, this is a really nice release for Pec Minor. And so going right between the filaments. You're trying to figure out how you could see me work and you see at the same time. Right, here you can see an idea of what you could do. We're just making an example through the shirt here, but first I was just doing the cervical, just head to chin or chin to chest, and now I'm having her bend at the waist. We can work all the way down. Almost like that structural release one where you dig in your forearms or fists into the back and have them do that. Here's doing some torso rotation, working on the intercostals, right? We could do any of these motions with our hands, but I'm showing ideas of how to use this with, a tool, right? So we're more aimed with the fascia. I think this might be a continuation of what I was doing before. They're just in all different random orders here. All right, so we can do a little flexion, internal, external rotation, extension, moving the arm in every way it moves. And these are just sweeping strokes as I'm doing them, but you could do that with brushing as well. Here we're working on some of those little tennis elbow areas. We want to work both the tennis and the golfers. Doing some strumming strokes, or I guess it'd be sweeping if we're on the pronator. And we're making the wrist extend. Right. I could have her do that, or I can make it move. Here we can do a little bit of that J stroke. Anytime you kind of lift away from the bone. A little brushing, a little strumming, multi-directional, diagonals. Yes, kitty. Okay, yeah. So we're working on the medial side, working on that golfer's elbow. I can work on her hand too. Getting the little velociraptor out for her. She's got a scar there on her forearm. Can't really tell, but there's a nice scar there with some hard adhesion underneath it. And we're doing a little bit of that fanning stroke with this tool to break up that scar tissue. And so we've worked above and below, and now we're working through. And smoothing it out. Some nice sweeping strokes towards the end. She's really tight here, so I'm ending with a lengthening or inhibiting the muscle. I guess I found one last adhesion in there. I go back for. You'll do that. You'll find stuff. You'll assess with that tool. Now we're getting into the hand. I can use some nice brushing on the thenar and hypothenar eminence. And then I can just move her fingers to working with extension.
Strokes, we can add in a little active release. So as I'm doing this, I can have my client go ahead and bend their leg as I'm doing some of these and then down. Strokes and do it passively for him, so he doesn't actively have to do it. And I